Hi students, welcome to the next video in your oral pathology sessions. In this video, we will discuss little about your dental caries and the histology of dental caries and what are the questions they will ask you in dental caries. Okay, so dental caries is a microbial infection condition that is affecting the heart tissues. Right, heart tissues of your dental caries. There are so many theories behind the dental caries, out of which our acidogenic theory, actually, that is most commonly widely accepted, but there are so many other theories like proteolytic chelation theory, what chelating theory, okay, theory of worms. So many theories are there, but most commonly the Miller's acidogenic theory is most widely accepted. Okay, now I'm not going to that theory things, that they are not going to ask you about these theories and all. They are concerned about the structure, the histology of enamel caries and dentinal caries. Now, how the enamel caries look like and how the dentinal caries look like. Okay, so enamel caries, there is two parts of enamel. If I take a tooth here, okay, I'm gonna draw a tooth here. Okay, this is a tooth crown. Okay, and I have enamel here, so this is the enamel. Okay, the red part is enamel. I have dentin, and inside this I have my pulp. Right, I have my pulpal tissue here. I will draw a pulpal tissue. Okay, so this is the enamel. I have enamel here. The enamel, this surface, this point is called your pit and fissure. Okay, this is pit and fissure, and this is your smooth surface. Okay, smooth surface. So the caries can either occur in your pit and fissure or in the smooth surface. Now the direction of the spread of this caries on the pit and fissure and the smooth surface is usually different. Okay, so you can see that this is a smooth surface caries. In the first image, you can see there is a smooth surface caries, and the smooth surface caries, can you see that in the outside it is a wider area, and it will extend inward like this, tapering. Okay, so you can see that there's a triangle which is formed, a triangle or which a pyramid which is formed there with the apex. So this is the apex spot. Now this is the dentin, this is the enamel, and this is what is this area? This is the DEJ, dentino-enamel junction, right? This area is the DEJ. Now this apex of this pyramid is going towards the DEJ, and the base is towards outside, right? Base of this pyramid, where is the base of the pyramid? The base of the pyramid is towards outside, or the triangle is towards the outside, and the apex is towards the DEJ. So this is what you see in a smooth surface caries. So in a smooth surface caries, the base is towards outside or the oral cavity, and apex is towards the DEJ, dentino-enamel junction. So I think this is clear. Now when it comes to your pit and fissure caries, see, this is a pit and fissure caries. So pit and fissure caries, what you see is that you see the apex is outwards. Okay, so the apex, the outer portion, it will be a small pit, but inside it will be a large caries. Okay, so the apex is outward, and this is the base. Okay, so here apex is towards outwards, and base is towards the DEJ. Okay, so this is the difference between a smooth surface caries and a pit and fissure caries. Now when it comes to dentinal caries, I will draw a dentinal caries here. Okay, see, here is the dentin. Okay, here we have the dentin here. Now what will happen if the caries come to your dentin? Okay, see, if this caries is progressing till here, what happens? This is the DEJ here. We have the DEJ here. The caries, as it comes to the DEJ, it will spread sidewards. Okay, so the caries, here is the caries. It is coming here, and from here it will spread to both sides. Okay, and then it will spread like this into the DEJ. Okay, means again it will taper down to the DEJ. Okay, so from the DEJ, it is always tapering towards the pulp. Okay, tapering towards the pulp. So towards the pulp, it will taper. Now for dentinal caries, either it be the any area it be. Here also it will come like this. Okay, if it is occurring here, it will come like this. So anywhere on the dentin, this is the dentin, anywhere in the dentin, the base of the pyramid or base of the triangle is towards the DEJ, and apex is towards the pulp. Okay, for a dentinal caries, you should always remember the base is towards the DEJ and apex is towards the pulp. Okay, so they can ask you what in a smooth surface caries, in a smooth surface caries, okay, it is what the base is towards outside and the apex is towards the DEG. In a smooth surface, in a pit and fissure caries of enamel, it is base is towards the DEJ and apex is outwards. So if what is the relation between enamel to dentin? What is the relation between enamel to dentinal caries in smooth surface? Smooth surface. So what is the relation between enamel to dentinal caries in a smooth surface? Means when you take a smooth surface, the enamel relation is like this and dentinal relation is like this, right? So it is enamel to dentin is enamel's apex is coinciding with or towards base of the dentinal caries. So enamel caries, the apex of enamel caries is coinciding with the base of the dentinal caries. Okay, got it. So this is how you should relate it and study. Now there is one question regarding the zones. What are the zones of enamel caries? What are the zones of enamel caries and what are the zones of dentinal caries? So just remember there is 4 zones of enamel caries. First zone is called a translucent zone. Translucent zone. Okay, so that is the first recognizable zone. First recognizable zone is the translucent zone. Then comes your dark zone. So dark zone is called a positive zone, which is called a positive zone because dark zone is always seen in the enamel caries, so that is called a positive zone. And third one is the body of lesion. Body of lesion is because it is having largest demineralization. That is the area of largest demineralization. Okay, that is body of lesion. Last is the surface zone. And surface zone is towards the saliva so that it will be more mineralized. So it is a mineralized zone. Okay, so you have a caries. If you have a caries in the enamel, and the outer surface of the caries is actually more mineralized than the inner caries. Okay, so inside the caries, it will be less mineralized because on the surface there will be mineral deposit, calcium deposit from our saliva, and the outer surface of the caries will be more mineralized. Okay, so this is the 4 zones of your enamel caries. And what about dentinal caries? Dentinal caries. So in dentinal caries, there are certain zones in dentinal caries. What are the zones in the dentinal caries? There is a first zone that is called a zone of fatty degeneration. Fatty degeneration. The zone of fatty degeneration is a place where you can see the tubules are showing fatty changes. So these tubules, dentinal tubules will show fatty degeneration. Okay, and what is the peculiarity of this is that they can be only seen microscopically. Okay, this is only seen in a seen with a microscope. Okay, you cannot see as a manifestation. Zone of fatty degeneration is the changes which see in the dentinal tubules. Okay, fatty changes, fatty globules start appearing. Second one is dental sclerosis. Dentinal sclerosis, zone of dentinal sclerosis. So that dentinal, why there is dentinal sclerosis? This dentinal sclerosis will prevent the invading organism. They will help to seal off the dentinal tubules. So that is dentinal sclerosis. Third one, that is decalcified zone. Decalcified zone where the dentinal tubules are decalcified. Fourth zone, little more outward, that is zone of bacterial invasion. Bacterial invasion zone, zone of bacterial invasion. And the last zone is the decomposed dentin. Okay, decomposed dentin. Now just remember the zones of enamel and dentinal caries. They are not going to ask you much about this. Okay, only this much is most important in your dental caries. Okay, see you in the next video with a new topic.